my On Conquering Schizophrenia Project, and I'm with schizophrenia guru or psychosis spectrum disorder guru, Dr. Robert Laitman, and I think he is resides in the Bronx, if I'm correct. He's an internist,
but my office is in the Bronx.
Okay.
He's a very first time for. We're moving to Westchester.
Sounds good. Doc. Dr. Laitman is on the Sartor board. He is involved with NAMI and the BBRF. He's an internist with a specialty in psychiatric care. And he does amazing work through his not-for-profit as well called Team Daniel. And he's an expert on the treatment of schizophrenia, including the use of clozapine. Is that accurate, Doc?
That is correct. I would say yes, expert in the management of psychosis spectrum disorders, and my drug of choice is, and in fact, really I've limited my practice to managing people optimally on clozapine, paying attention to the metabolic side effects and all the predictable side effects that you would get. You know, in my experience, it's not been a standalone medicine. And when I say, mitigating side effects, it's not all about adding other medicines. It's paying attention to diet and really stressing exercise. For instance, today I just ran a marathon with a fellow who is on clozapine. And then my son Daniel is running a 5K. And we really push the exercise part of it as we do with the diet, because, as you know, most of these antipsychotics have the reputation, and clozapine and Zyprexa are the two that have the worst reputation with weight gain. And people use it as an excuse not to use these medicines. Now, in my practice, the vast majority of my patients lose weight while on clozapine. But that's because as I said, stress, diet, exercise, and used other medicines such as metformin.
Well, in my own recovery, exercise has been hugely important. I have a total gym that I like to use 3 or 4 times a week, and I like to run once every 2 weeks for 5 miles.
You're going out with me. Maybe not.
I don't know, Doc, about 26.2, I don't know.
Well, no. We'll cut out.
Okay, we'll do a 5K. I can do a 5K.
Yeah, that's all I did with it. That's all I did with my son. And that's how I got started, is my son. Back now, 15 years ago, when my son developed psychosis, we were essentially told his life was over, and he was really quite ill. He was at one point catatonic. And, we were told he probably wouldn't finish high school and prepare, to mourn your son. And I didn't find that an acceptable answer from the psychiatric community. And then I started to read. And the more I read, it became apparent that he was being absolutely not appropriately treated. He was on 3 different antipsychotics by someone who clearly didn't know what they were doing. And, as you read and you read about quote-unquote resistant schizophrenia, there's only one drug that stood out, and that was clozapine. And a year and a half, actually, to get him on it. And it was a lot of resistance from my wife, who's more reasonable than I, who's also a physician, who's also now embraced clozapine and now has, a group of patients also on clozapine. And, I can see your reticence. We're always taught never to take care of your own, right? That's one of the things that they teach you in medical school. But my issue was I had no one that could take care of them the way I wanted them to be taken care of. So, my wife and I had to figure this out or my son wouldn't have a life. So I was very motivated. And he became our NO1. And, that was 13. He's been on clozapine now 13 years. And you would, he's a stand-up comic. He graduated from college. And he's our model. His weight is fantastic. When he first started clozapine, he's a little guy. He's only about 5'6". He weighed about 170. And
I was listening to Dr. Laitman. I was listening to
this is, I'm extraordinarily proud of him. I mean, he's a great stand-up comic, but he's also embraced his identity with, and our community of people with serious mental illness. And he's starting to mentor some of these kids. And it's really been so gratifying. So what we do, since COVID came, before COVID, and this I know is not the typical for a treating physician, I find that there's that separation between the physician and the patient and the family, and it's very, I think it's inhibiting, and I think it inhibits the therapeutic relationship. So for years, we'd actually had people come to my house and run with us, come into my pool, swim with us, and talk, both the family and the kids. Now, that disappeared with COVID last year. So what happened is, every Saturday, we have Zoom meetings. And like yesterday, I had 38 different groups of people, because usually it's the husband and wife that's on, and that's the parents. So we go from 11 to 2. But what's cool is the kids, and the kids range from 16 to 74, so maybe not all quite kids, but the people that are actually being treated with clozapine will then Zoom from 2 to 4. And Daniel's a real leader there. And he just asks questions, and they talk, and there is this tremendous sense of community. And he's now taking a course to become a peer counselor on top of his stand-up. His true love is stand-up. True love is stand-up. But it's very exciting to watch all this evolve. And it's getting rid of the isolation, getting that sense of community. I can't stress that enough.
Yes. Doc, if there's one last thing, I only have a minute. I wanted to ask you if there's one message that you can give to people who have a psychotic disorder, what would your advice be?
Clearly, if you're really affected by a psychotic disorder, you want to educate yourself about what is possible and not take the dogma and the nihilism that's out there in the psychiatric community. This is the best that they can do, and clozapine is too much work. There is a correct way of doing it, and it's not just giving them clozapine, it's doing the whole